Our next topic is disorders of skeletal system. Chapter 13, Sport and Movement, Biology, Class 10. Disorder means out of order, out of arrangement, derangement of skeletal system. There are two important disorders of skeletal system discussed in your book. One is osteoporosis and the other is arthritis. First we will discuss osteoporosis. Osteo means bone. Porosis means pore formation. Formation of pores in the bone is called osteoporosis. Pore means empty spaces. This pore means an empty space. Bones consist of the minerals of calcium and phosphorus. In the disorder of osteoporosis, there is little or less calcium and phosphorus in the bones. In osteoporosis, bones become short of calcium and phosphorus minerals. So when there will be no calcium or very much less calcium and phosphorus, there will be more pores, more empty spaces. The pores which were previously filled with calcium and phosphorus now have no or very much less calcium and phosphorus. That is why porosis. Osteoporosis is characterized by the lack or too less calcium and phosphorus in the bone. What is the reason of too much less calcium and phosphorus in the bones? There are many causes, out of which one is malnutrition. Malnutrition means you are not eating the food which contain calcium and phosphorus. You are eating other foods in more amount, and the foods which are necessary, which are containing calcium and phosphorus, you are not eating those food, is called malnutrition. In particular, the protein food is absent in your diet and the vitamin C is also absent. The deficiency of vitamin C and proteins causes loss of calcium and phosphorus. Other reason of the osteoporosis, other cause of the osteoporosis or other cause of the deficiency of calcium and phosphorus in the bones is lack of physical activities. When you do not do much physical activities like exercise or hard work, your bones become brittle and they may break at any time. Means you may be a patient of osteoporosis due to the lack of the physical activities. Another reason or cause of osteoporosis is The another reason or cause of osteoporosis is lack of a hormone called estrogen. You can write O with S directly removing the E between, or you can use the E. This is Britain spelling. Estrogen is hormone whose function is to store calcium and phosphorus in the bones. When your body is not producing estrogen hormone, you will not obviously store calcium and phosphorus in your bones. You are eating the food containing calcium and phosphorus, but you are a patient of osteoporosis. The reason is you have very much less estrogen or no estrogen at all. That is why the calcium and phosphorus is not being stored into your bones and you are a patient of osteoporosis. This hormone is generally produced by men as well as women. But when the reproductive cycle of women stops, the production of estrogen is also stopped in women. Because reproductive cycle of men does not stop till the end of life, that is why men keep on producing estrogen as compared to the woman. Usually reproductive cycle of the woman nowadays stops at age 45. After this age, women stop to produce estrogen and there will be no storage of the calcium and phosphorus into the bones of the woman. And women have more chances to develop osteoporosis after this old age. Osteoporosis so more affects old women as compared to the old men because they have less chances of less production of estrogen as compared to women who have deficiency of estrogen after 45 or 40 years of their age. Now we talk about the second type of skeletal disorder, arthritis. The word arthritis is taken from two words. Arthro means joint, itis means inflammation. Arthritis is inflammation in joints. When joints become swollen, they have inflammation in them. Inflammation means swelling. The swelling of the joints is called arthritis. In arthritis, there is too much pain, severe pain. There is also fever and lack of movement. As well as stiffness of joints. It is obvious that when joints will become stiff, they will become swollen, they will be having an inflammation, and when there is stiffness in joints, there will be loss of movement, which will result in severe pain and fever followed by. Because arthritis is an inflammation, the treatment of arthritis is done by using the medicines which are anti-inflammatory medicines. Anti-inflammatory medicines are used to reduce or eliminate the inflammation of joints. And to avoid severe pain because of arthritis, painkillers are used. Two types of medicines, painkillers and anti-inflammatory drugs, are used as a treatment of arthritis. Arthritis consists of many types. There are usually 100 types of arthritis. But in your book we will talk about only 3 types of arthritis. There are 3 types of arthritis described in your book. One is osteoarthritis. Other is rheumatoid arthritis. And still other or third is gout. Osteoarthritis is an arthritis, a type of arthritis in which the cartilage present between bones is removed, or the lubricant present between the bones is removed. In osteoarthritis, the lubricant is removed and or the cartilage is lost. The function of cartilage is giving the bones a flexibility for movement. When there will be no cartilage, bones will be locked into each other and there will be too much difficulty in movement. Lubricants also do the same function. They act like grease and oil to make the movement faster between the bones in the joints. So when there will be no lubricant or less lubricant and no cartilage, the bones will be locked and there will be no movement. In rheumatoid arthritis, there is no any removal of lubricant or cartilage, but in rheumatoid arthritis, the membranes present at joints are inflamed, swollen. It is due to the removal of it is due to the swelling in membranes at joints. Like other types of arthritis, osteoarthritis mostly affects the weight bearing joints like hip joint and ankle joint, and rheumatoid arthritis also affects the heavy parts of body like hip joint and ankle joint, because our hips have to carry the weight of all the upper body. That is why there are more chances of rheumatoid arthritis to attack at the heavy weight parts of the body. Osteoarthritis also similar. The main difference is the cause. In osteoarthritis, cause is removal of the lubricant or the removal of the cartilage, but in the rheumatoid arthritis there is no any removal, but there is increase in the size of the membranes of joints. The third type of the arthritis, which is very much common, it is due to the accumulation of uric acid. Accumulation of uric acid. When your kidney is not functioning properly, uric acid starts to be collected in the body, in particular the weight bearing parts, and in particular the feet and toes. Gout is attacked. Most of the uric acid goes down in the very last parts of the body, in the last parts of the leg, in the ankle, in the feet, and in particular the toe. The people who are a patient of gout have their foot big, have their toe large. They are characterized by a big toe or by a big foot, the patients of gout, which is because of the accumulation of uric acid, and it creates a lot of pain as well as loss of movement.